following a traditional Silicon Valley mold as far as raising capital. Right now, we're raising our seed round. We raised a little bit of money, and we're still trying to fill our round currently. Based out of San Francisco, California, and our team is folks that have worked at startups before and have had startups that have exited it as well. So we're familiar with that landscape.
From MJBulls Media, it's the Raising Cannabis Capital Show. Today at Raising Cannabis Capital, we are joined by Steve Deol from Track My Medicine. Steve, welcome to the show.
Thank you for having me, Dan.
Steve, with all the information out there about cannabis, it's easy to forget that we're just getting started. And there's so much information about cannabis that we still don't know. Track My Medicine, the way I understand it, is helping us better understand cannabis and how to incorporate it into patients' treatment. I'm going to let you explain how you do that.
Yeah, the world of cannabis, it's a lot of folks are looking to use cannabis for healthcare. And even in recreational states like Cannabis, the medical products are flying off the shelves. However, with patients with really critical issues such as cancer, those type of things require physician oversight. They're not just using cannabis, they may be using other treatments. So the way that we're actually solving this problem is first by helping physicians incorporate cannabis into healthcare and do this responsibly and do it in a way that it actually works. And if it doesn't work, you stop and you make an adjustment. I'll illustrate that with a little story. If you have somebody that's going through chemotherapy and they're looking to increase their appetite because they're having a lot of nausea, old adage was go ahead, use cannabis, and it'll actually help increase your appetite. So a patient goes in to a dispensary and goes and purchases some cannabis. And they start using it. They notice that they're actually losing their appetite. It's actually killing their appetite. They're thinking that, hey, cannabis doesn't work the same way for me. It could be that they actually purchase something like Durban poison. That particular strain is high in THCV. THCV is actually an appetite suppressant. However, the physician doesn't know this. The patient doesn't know this. And the benefits from cannabis are not being realized for this patient. So what Track My Medicine does is gives physicians the tools to get down to a level of detail and make that recommendation based on the patient's condition. The physician may want to get to the exact cannabinoid or terpene that will actually bring out the desired effect for that patient. And the interesting thing is everyone's endocannabinoid system is different. So what works for person A may not work the same for person B. And the nice thing is, with lab testing, you actually know which cannabinoids and terpenes are in the products. So the physician can actually go and make those recommendations. The patient can take that recommendation into a dispensary the same way you would take a prescription into a pharmacy.
Wow,
and the interesting thing that we do is we actually provide a feedback loop. So after that patient makes that purchase shows up in their mobile app. After they consume it, we ask them, did this help you with your nausea? That notification will go back to the physician.
I think I got it, but let's just make sure, because I'm the one most likely not to get it, but I want to make sure our listeners get it. So when they make the purchase at the dispensary, they get a notice to download an app at that time?
No, actually, when they visit the physicians that are using our platform, they can enroll the patient to Track My Medicine. And that's a feedback-based system. And essentially on the physician side, it's like an EHR or electronic health record where they can go and prescribe down to the level of detail that cannabis has.
I see. Will the dispensary information eventually sync in with the doctor and the patient's app?
Yeah, so what we're looking to do in the long term is actually tie in physicians' offices with dispensaries. So when a doctor makes a recommendation, they should be able to query what's in stock at the dispensary and put those products on hold so the patient can buy the exact thing the doctor recommends. And that's another issue in the industry because inventory changes over so often. A lot of times when the patient is looking for the product that was recommended by the physician, they go to the dispensary and it's not found. And the bud tender may just give them something that's completely different. Adherence is a big thing that we want to hopefully drive.
Yeah. Well, this is really good stuff. Plus, it'll improve when the patient goes in to visit the doctor. He already has all that information. It's not up for the patient to sort of recite what has happened to him since their last visit.
We're really aiming our product to help the 55 and up, the population that are really benefiting from cannabis. And in that area, you need to get down to a level of detail because you're really trying to help folks solve some pretty tough medical issues.
There's very few people over the age of, say, 60 that aren't on some medicine. So how that interacts, this is all this information that we're going to need to know as we move forward. Well, you talked about eventual hooking up dispensaries into this network. What else is next phase of development for Track My Medicine?
Yeah, eventually, like our long term is we actually want to tie into all other medications a patient's taking and get a holistic view of patient's care. And already in our current mobile app, the patient can put in current medication they're taking. However, we want to do it in an automated way where everything can be linked in and the patient can really see which medications are being reduced by using cannabis.
I see.
And long term, what we want to do is we actually want to be a data repository that shows, of course, with anonymized private data, adhering to all of that, is figuring out what are those active cannabinoids and terpenes that work best in which ratios for which particular disease or symptom for which demographic. We want to get down to that level of detail and have that data to help fuel the industry and cut down drug development time. We want to find out what works the best, and that's hopefully the data that we'll be able to uncover. And we will uncover that if we have enough folks using that platform, because it's going to be exact recommendations from a physician based on a real disease. And since everything is being lab tested nowadays from the dispensaries, we know the exact cannabinoids and active ingredients that have the highest efficacy to treat a particular disease. And we have patient feedback on how well it works.
Yeah. It's going to be complicated, but I think you're on the right track, especially the complications of HIPAA laws and everything else, but you have to integrate it with everything. Feels like you're on the right track. But a project like this, that's really a lot of upfront costs. How have you funded it so far? And, what are your plans for funding the next phase?
Yeah, we're following a traditional Silicon Valley mold as far as raising capital. Right now, we're raising our seed round. We raised a little bit of money and we're still trying to fill our round currently, based out of San Francisco, California. And our team is folks that have worked at startups before and have had startups that have exited it as well. So we're familiar with that landscape.
Sure. Sometimes I like to ask what's some qualities or characteristics that you would look for? What type of investor?
Yeah, right now in the stage we're at, we're looking for qualified angel investors as well as seed round VC funds. Those would probably be the folks that'd be the best fit for us.
Well, we'll have all Steve's information and Track My Medicine's information. And if there's any investor information that's available, we'll have it on the MJBulls website. So if people that are listening want to follow up to dig deeper into this, we really just skimmed the surface of all the things that Track My Medicine is doing. And there's so much more that we don't have time to talk about today, but needs to be discussed and need to be reviewed. And actually, you guys need to get this done because it's important stuff. Steve, thanks a lot for being on the show.
All right, you're welcome. Thanks for having me.
Good luck with this.